Hello friends, welcome back. We continue with our review of pharmacological actions of drugs, and in this lesson we shall be taking a look at the placebo effect. You must have heard very often that homeopathy is nothing better than placebo. Well, many people may be having that belief. Are we sure what we mean by placebo effect at all? The purpose of this lesson is to look at this a little more closely. Actually, the definition of the placebo effect has been beautifully summed up in this paragraph. A placebo is a substance provided to a patient that the physician believes has no specific pharmacological effect on the condition being treated, and the patient believes the treatment will work. Now, you will notice in this particular definition, the word belief or beliefs comes twice. There is a belief of the physician that it has no effect, and there is a belief of the patient that it will affect. Two opposite beliefs, and they still have tremendous effect. Is modern medical science based on some belief system, or is it based on some hard evidence? Let's take a look deeper. So the question that comes is evidence-based medicine belief-based rather than being a hard science? This is from a research paper, and I shall give you the reference shortly. It says that the evidence-based medicine model of clinical practice, as it has evolved over time, is largely belief-based because it is lacking in empirical evidence and theoretical support. The model is not well developed and articulated in terms of defining model components, justifying their inclusion, and suggesting ways to integrate these in clinical practice. Now, that's a pretty serious indictment. For those of you who wish to pursue this paper in depth, can use the reference given here. This is from the Journal of Evaluation in Clinical Practice, and this paper is from the year 2011. The placebo effect has often been researched to great lengths, and the psychologist named Irving Kirsch in 2008 published a meta-analysis of a number of papers dealing with psychiatric practice. And he stated that 82% of the responses to antidepressants was accounted for by placebos. He was derided, ridiculed, and it became a very controversial study. However, shortly after, Khan, Redding, and Brown came up with similar findings. They dealt with 3,063 patients, and they discovered that 79% of the placebo responders remained well for more than 12 weeks after the initial placebo treatment for 6 weeks. A very wonderful finding that explains that placebo effect is not something to be sneered at. Those of you who wish to pursue this reference in greater depth can follow the details given here. Walter Brown, in his book, The Placebo Effect in Clinical Practice, states that brain imaging studies over the past decade have shown that placebo-treated patients undergo some of the same changes in brain activity as those treated with pharmacologically active substances. Yet, this important component of healing is not yet harnessed in clinical settings. So far we have seen that placebo effect is a real effect. It can be used effectively in clinical practice. It is not something of a belief system, and as we saw earlier, the whole structure and setting of evidence-based medicine itself is based on some belief. The fact that this effect is under-recognized is because placebo effects frequently occur in clinical practice and often go under-recognized. The placebo effect is considered a melting pot of ideas in neuroscience. Some of you might question, is it ethical to give a placebo and to fool the patient? Well, homeopathy uses this in a very different way, as we shall see shortly. The responses to placebo system come in various systems of our body. At the autonomic response level, the prefrontal cortex and the higher brain regions which respond to words, they can be easily harnessed for analgesic or pain relieving purposes. At the neuroendocrine level, they affect the hypothalamus and pituitary hormone axis, which controls so many fundamental physiological processes. And importantly, the immune system is also affected. For example, taste cues suppress peripheral immune response. And very often that determines the taste of the medications which are supplied to patients. Let us see how we can use this knowledge and information in our day-to-day clinical encounters. A routine clinical encounter consists of three components. These components are assessment and observation, which can be from lab reports, physical examination, and interview. This is a basic requirement in any form of medical practice. The second one is the therapeutical ritual. Everything that we do inside our office or clinic is essentially a ritual, and that is found to have a modest benefit. We shall see these three things in greater detail in a graphic that will come in the next slide. The third and most important component is the physician-patient relationship. We have seen in another lesson the importance of narrative medicine and how that helps us not only to access the emotions and the inner recesses of the patient's mind, but it also has a therapeutic effect. And in homeopathy, that narrative is going to help us find the correct remedy. The physician-patient relationship is the most robust component of these three components that compose the clinical encounter. Let us see how it works. This shows a practitioner with a patient. A simple verbal suggestion, this is going to make you feel better, is going to have an immediate impact on the healing of the patient. There can be other cues, such as the doctor's office, the kind of charts and pictures that are put on the walls, the kind of setup. As a matter of fact, the current thinking is that having the doctor or the medical practitioner sit across a table itself is very dominating. It would be preferred if they could sit side by side or at an angle of 90 degrees on a sofa without any barrier between them. Such a setting makes a big difference in the final outcome. Then there are social cues such as eye gaze, the body language, the kind of language that the doctor uses, the use of a white coat. In fact, many doctors are giving up the use of a white coat because that is found to be very intimidating. The stethoscope around the neck is also a stereotype, which puts the person into the frame of being controlled by a system or environment. Besides, the stethoscope and the white coat are often the main culprits in retaining a lot of germs, viruses, and other microbial elements which could be harmful to the patient. Then there are treatment cues. Syringe, needle puncture can be quite intimidating and threatening. There have to be ways in which this can be overcome. Lastly, it is the patient's perspective. What are the outcome expectancies? The person has come, for example, with an expectancy of overcoming pain, or it could be, in case of a psychologist or a psychiatric encounter, about feeling less anxious. One of the most important things is, does the patient feel that he or she is being cared for? All these precognitive associations and explicit memories of the past can affect the final outcome regardless of the medicine used or the procedure adopted. Placebo effect is not just limited to drugs. Even sham surgeries have been found to be as effective. In fact, there is a study which you will find in the reference section, which found that the outcome of sham surgeries was in fact better than actual surgeries. This fact only underlines what we have stated in the past few slides. Psychotherapy makes tremendous use of the placebo effect, and techniques such as creative visualization, clinical hypnosis go a long way in affecting the outcome in a very positive direction. Homeopathy uses the placebo response in a very artful way and a very ethical way. A homeopath will usually be giving a single remedy to a patient, and in fact, it starts acting with a single dose. Usually, this will be followed by a period of wait and watch. However, most patients are not accustomed to this idea, and they would like to have a dose 2 or 3 times a day. And for this purpose, the homeopath could give them just simple placebo pills or sugar pills which look exactly like the remedy itself. This covers the wait and watch period, which is the essence of homeopathic practice. So ethically also it is perfectly fine. The placebo can be repeated as often as the patient desires, because that also strengthens that person's belief and indirectly affects all the physiology that we studied in our earlier slides. That brings us to the end of this lesson, and I'm certain you'll be looking at the placebo effect not just as an irritant in studies or in trials, but as a very potent and powerful tool which you can use, and which homeopathy uses to its best advantage and very ethically too. So thank you very much for your attention, and we shall meet once again in our next lesson. Until then, bye bye.